webinar. So I wanted to thank everyone today for joining our session on an automated approach to managing your sanctions and exclusions process, dealing with integrity issues within your organization and how to make that process that much more easy, more effective, and more safe for your organization. My name's Tom Leahy. I am the Senior Vice President of SureShield, and I have with me our CTO, Chande Bilagu. And the two of us have been in the healthcare compliance and risk arena for close to 25 years, have done a lot in the areas of safety, quality, compliance, and risk management. And have done a lot to help organizations, I would say, improve and make the process of managing their screening process that much more easy. So in terms of the agenda today, we'll talk a little bit about things that you are well aware of, the OIG oversight and the processes that you need to adhere to as a healthcare entity regarding meeting OIG enforcement activities, specifically making sure that those that are working with your organization are allowed to do so and are not banned or excluded from any state or federal program in doing such. We'll talk a little bit about the ramped up enforcement that is continuing in lieu of a number of things that have happened, COVID being one of those, put a lot of pressure on the system, introduced a lot of new bad players into the market, and then we also have issues with various hostile nations now that have individuals and companies that are getting excluded or sanctioned and prevented from working with entities, and those entities do include healthcare organizations. We'll speak a little bit about the current challenges, of course, that you all face if you're responsible for managing this process, and really how you can leverage technology, perhaps leveraging or utilizing a new approach that we'll speak of through SureShield to help, I would say, automate and kind of autopilot a lot of that whole process in covering you completely, meaning across the entire ecosystem of your organization. We'll do a very brief product demo. We'll take questions, and during this, we'll also have a couple of poll questions for those of you who are interested. At the conclusion of this session, we will be offering the ability for you to trial our solution at no cost. Very simple way for you to actually compare and this to perhaps processes that you're using today, and you can do that at no charge. So as we get started, as all of you I'm sure know, obviously the Office of Inspector General under the Health and Human Services Organization is responsible for looking and making sure that organizations that work with vendors or individuals or providers, making sure that they are working with those that are not sanctioned or excluded from working with federal or state programs. And as we know, we'll show a couple of examples. Doing so can really bring very, very large fines to your organization, can have reputation issues for your organization, and really get you in a fair amount of trouble if you have employed or are working or with those types of individuals. And those penalties can be very large, particularly if they have anything to do with folks that are submitting claims, perhaps third parties that are submitting claims on your behalf. You can face some pretty stiff penalties for the amount of those that may have been done without you either reporting that individual or the government finding out about it. And then, of course, we also have the issues of compliance related to HIPAA, which is overseen by the Office of Civil Rights. So if you're compliance professionals, you kind of have a double whammy of different oversight organizations that you need to be working with. And recently, those enforcement efforts have really begun to kind of ramp up. I would say the OIG gave a little bit of latitude during the beginning of the pandemic when healthcare organizations were facing a lot of issues. Obviously one, the most important, trying to take care of people that were affected with this particular virus. But of course, when any of those types of things happen, as we know, bad players also oftentimes get introduced. You see issues with, recent hurricanes where people are taking advantage of those situations to try to steal or defraud the government. And the same has happened in healthcare with the COVID crisis. So on top of that, the OIG, I would say, provided a little more leniency and understanding that because of the crisis that the healthcare system was dealing with, they were not going to be as perhaps hard-nosed on this process outside of trying to make sure that they were keeping bad players out. But to date, really, those enforcement activities are beginning to ramp up again. We've heard a lot of news, at least in the government side, about the federal government increasing resources, not only with the IRS, but with other enforcement organizations to make sure that people who are receiving federal money are not receiving that wrong. And if they are, they're going to put some pretty stiff processes down to recover that money or those monies. And just in the last 6 months, so the recent OIG investigative report was reported to Congress. This covered the time period of the 21st of October, or October of 2021 through March of this year. And really, they are expecting over almost $1.5 billion in expected investigative recoveries, which means they're looking into a lot of things, and they're making sure that they're taking strong action on organizations or individuals or entities that are either doing fraudulent things or employing and working with individuals that they should not be working with. You can see there were over 300 criminal actions, a number of civil actions, and just in that 6-month time period, there were over 1,000, almost 1,050 individuals and entities that were added to the exclusion list. And that's a pretty significant number in that short period of time, meaning there's more and more bad potential players that are trying to get into the marketplace or do bad things in the marketplace. And of course, we have additions to these federal lists that have come from, because of issues we have with what we might consider the hostile countries or nations. We have several Russian companies and Russian individuals that are now excluded, have been gone into sanction or exclusion lists. And, ironically, you could very easily have some of those without knowing it that are doing work with your healthcare entity, be it a hospital, a physician practice, a long-term care facility, whatever that may be. And then, of course, the nation of Iran is adding these as well. So as a responsibility that you have and the recommendations that the OIG has in terms of this oversight activity, first of all, and I'm sure all of you are probably doing this, you should be screening all new employees, providers, contractors, or vendors. So anyone that's potentially coming in to your organization should be screened prior to you doing any work with them. And I assume a lot of you are doing that. So there's a recommendation to make sure that any new providers or prospective providers are screened. And keep in mind that screening, depending on how you operate as an entity, you have federal databases. You also have state databases. And if you're operating, obviously, in one state, then you should be for sure checking your own state databases. If you're operating in several states, you should be checking those several different ones. And either way, you should probably have a methodology to be able to check all of them, because you might have someone coming in from another state that you're not aware perhaps was on an exclusion list, and you want to be careful about whether you are going to move forward with that person, entity, or contractor. And then it's recommended that a rescreen be done monthly on all of those same people in that ecosystem. And ways to protect yourselves in that is that you really need to provide very good, solid proof of screening activities. How often you're doing it, what the dates are, what the databases are that you're checking, how frequently, and having a good audit log of that in the event that you ever identify or have some of those in place. You will face less stiff penalties if you can demonstrate that you have a sound process for this oversight activity. And obviously, should you identify an individual, you should have activities, or you should have ways in which you can act very quickly to, first of all, validate that, and then, of course, remove them from that environment if that is the case. And this database, as I said, these databases between just the federal and state lists continue to increase. So there's well north of 100,000 that are on that list today. If you are operating in an entity, a lot of our clients have, are looking at a minimum of, 5,000 different individuals, entities, vendors that they're having to take a look at and monitor on a regular basis. And that becomes a very difficult task if you don't have good tools to do so. So I'm just going to take a very quick poll before we go on, continue on into the program, to just ask amongst the audience kind of really, how do you go about this? How frequently do you do this if you are responsible for that? And how do you go about doing that? And I will launch that poll. I'd ask that you just go in and briefly answer those questions for us. And we will leave that open for a minute and move on to our next component. And I see a number of folks are continuing to open, so I will just move over for a minute before I end the poll. But to just show you some of the recent examples, as you know, this is happening regularly. These are just a few examples. You can go on to the OIG HHS fraud enforcement database, and you can see all the different activities that are taking place, or the different types of sanctions, exclusions, and penalties that are happening here. So almost every, as I mentioned, every month, you can see this. And there are, hundreds of new additions to this list based upon the various types of things that are happening. And it looks like, if I go through a little bit of the results, a lot of you are trying to do this monthly, many either yearly or biannually. And a lot of you are doing this in-house, or a small percentage are sending it out to a third party. So if you're doing that in-house, I'm sure you probably have issues in terms of how often you can do that and how thorough you can do that, depending upon the number of providers that you have within your existing organization. And so as we have seen and found, where are those challenges that a lot of you face? Depending upon the size of your organization, but either way, it can be a very expensive, manual, time-consuming, cumbersome process, as we talked about, and we will show you briefly when we get into a little of what needs to be checked and how SureShield can help in that process. There is literally almost 45 different databases that should be checked. And many of them are not that great about telling you how often they're updated, how often things have been added to that. So you don't have a lot of information on what has been added and when that's been added, both at the federal and state level. So it's a difficult process to be consistent with. It's often done on spreadsheets. There's really what I would call automated access to federal and state exclusion databases. You're either doing that manually or periodically checking these, or have a process in to do that, which is good if you do. And sometimes, as you said, and a couple of the folks here that responded to the last poll indicated that you sometimes will rely on third-party sources to do those checks for you. And that's great. The only issues, again, that you have are latency issues, meaning they're only as current as the time and when that has been checked. So you could have lag times or times in between, even if you're doing something on a monthly process. And I'm going to show you kind of a pictorial of that where you have lag times where you might not know about someone coming on or being put on that list, and therefore, again, putting your organization at higher compliance risk and higher risk for potential penalties. So how do we help solve that process? And particularly, a lot of folks that we've had, because of either resource constraints, are using the Integrity Shield solution from SureShield. They've either ended up being able to bring that oversight back in-house, or they've been able to actually significantly reduce the manual requirements that they have internally in doing this. So what we provide is a real-time automated and continuous monitoring across all these databases. So basically, as we mentioned, there are these, at least, there's actually more, but there's, between the federal and state exclusion databases, there's over 45. We have developed technology that scrapes those databases on a nightly basis. So we will go in every day and see if there's been any kind of modification or change to those, any additions, subtractions at both the federal and state levels. And then match that up to our customers' ecosystem database, be that their vendors, their physicians, their employees. Some use it for some particular, some use it for everything. A lot of ours like to use it to cover everything because it's comprehensive enough and it allows you to distribute work to the various types of entities that within your organization that need to look at that. It's very simple and easy to set up. Really, it's activated. It's a web-based tool that really can be turned on and it start working for you in a matter of days, if not even hours. And it will, as I said, perform these integrity checks on all your vendors, your business associates, your employees, your contract workers, anyone that's in there will help you with that. And then it also gives you as well all the insight reports, comparative analytics, audit trails that you would need to have, particularly if you did have an issue and had to show them how you've managed that process. But we consider this, again, really a more dynamic tool that really does all the lion's share of the work for you. There's no need for you to quote unquote check. What you want to know is if you have an abnormality or you have an issue and be able to take action on that issue. And so the Integrity Shield solution allows you to do that. So it kind of does what I would call a manage by exception. It's going to look at those databases. It's going to compare them to the information you have in your own ecosystem nightly. And then it's going to tell you and message you and alert you if there are changes that require your specific attention, are going to direct you to those. So I give you just kind of an animated pictorial of even the differences between how our solution works as opposed, because I know many of you said you were doing this monthly, and hopefully you're doing all of your folks monthly. That can be kind of hard to do with a manual process, particularly if you're a larger entity that has lots of vendors, lots of employees. But even in a small entity, checking monthly can be difficult. So I give this example. If you look to the left, that would be a current process. So let's say on day one, or beginning of the month, you checked that database and you found that everything was good. That particular provider was not on the list, was not excluded, not sanctioned, everything was fine. However, 3 days later, they ended up on that list. Well, you're not going to know for another 27 days if you're doing this on a monthly basis, whether that person or that entity or that individual or company was on that list. And now you've got 27 days of exposure. And oftentimes there's not as many doing it monthly, meaning that you could have multiple months of exposure. And those come with very significant fines. So in our example, if you had 28 days at $16,000, you're exposed to almost $500,000 of penalties. In the case of the SureShield solution, on day one, we would have checked, of course. And on day three, because we are doing this automated nightly ping and comparison, if that provider showed up on day three, you would know on day three that that provider or that entity was on there, and you could have taken immediate action to prevent any further issue. and I'm not going to go into this too much around this pictorial, but basically, like I mentioned, we're going in and looking at all the state-wide exclusion databases, all these federal databases, the practitioner license databases, and then we are comparing that to the provider credential database that you've provided us, or the ecosystem database, and then you're getting a dashboard view and queries and information about any changes in that history. And again, we cover right now, there's even been additions. There's a few states that don't have exclusion databases, but there's now over 40, I believe 45 different databases that we're checking nightly around this. So I'm going to pause there briefly and just give the folks that are participating here a very brief demo of how our solution works. So Chandi, I know you're participating with me. Can you just validate that you're seeing my screen?
Yes.
Great. So in this example, this would be what I would call perhaps a smaller entity. But if you're looking at this dashboard view, what it's telling me is within my ecosystem, I have 193 records. Amongst those in this entity, I've got 20 employees, I have 150 entities, and I have 23 individuals that I am doing oversight activities for. Now, these are color-coded screens as well. So if any of those had popped up in an area or an exclusion being sanctioned or exclusion, then you would have an immediate warning, and it would call those out and show those to you. The other nice thing that this particular solution does, so if I were to click into this, it will get me into a filtering area that allows me to go in and filter my different, all this information based upon things that I may want to look at, or even setting it up in a means for, let's say, your provider credentialing department to have it for their purposes, your supply chain groups to have it for the vendors or whoever's managing that, and then maybe your HR folks are handling the employee aspects of this. But you have a lot of freedom of how you set that up. So if I were just wanted to look at the employees, I could filter on that, and it's just going to call out and show me the employees involved in this. And then again, various ways in which I can look at this information in terms of how I may want to filter and look at the data. If I were coming out and wanting to go back to take a look at, sorry about that. Get home here. Wanting to take a look at those excluded providers, you'll see if I were to click into here, it's going to show me specifically those ones. The other nice thing that we do, or that's very beneficial to our providers or people that work with us, is as we are going into those databases, we can indicate and tell you not only if they're currently excluded, but perhaps if they were in the past. So let's say you have a new provider, a new company that's coming to you, and you want to do a quick screen, you want to screen them, start that out, you're going to want to see, maybe they're not on the list now, but if they were on the list in the past, you may want to know that and have it may have an impact on your decision in terms of how you go about dealing with them. But then it's as simple as clicking into that provider, seeing what the issues were in terms of, in this case, this particular provider, it has 3 current exclusions and sanctions. You'll note that there's an audit log, a document room to provide any information that you may need to have in terms of auditing that activity. If I click into this, you'll note that this is showing me, depending upon the database. So in this case, this particular provider was on the LEIE, the SAM, and the Ohio State Exclusion Database. And it will give you the information in terms of what were they prohibited, what was the exclusion code type and all, if they have that, for further drill down. The other thing that we provide to you, because sometimes you do get what they might call false positives, or once you get something, you may want to just give that person, that company, the opportunity to provide information to you as to why they're on that list. So you can see that I have these options as well in here to either initiate a request for data or initiate a request for verification. So perhaps this was on that list. It will automatically generate for you kind of and again, you can create your own templates for this. An email that could say, hey, we've noticed you've shown up on this list. We would like you to give some validation as to why or why not we should, help us understand what's here and validate this information. So a lot of what we call workflow to further help you manage that overall process. Now, in terms of setting things up and getting providers in, we have 3 different processes that you can go through to do that. One is just the individual manual process. So let's say you have a new entity that's coming on board, and you want to, first of all, you're considering coming on board. It's a prospective entity, and you can indicate what that particular type of entity is. Is it a vendor? Is it an individual? Is it a medical staff? Is it an employee? And you can actually run an individual check right off of this. So if I had entered some specific data on that individual, it will then take you and run an immediate check and tell you whether they've shown up or not shown up on that. Conversely, not a lot of folks often want to just do this one by one. So you have the ability to even upload a set of records into this. So we give you templates in order to run those and have us do those regular checks as often as you like. And many of our folks now have come to us to help automate even what I would call more real-time access to those source databases so that we get those updates, we match it, and then we can just flag those and tell you whether you have an issue. So really fully automating the whole process. For some, that may be a little bit more than what they need, depending upon the number of organizations or individuals or entities that they want to check. But what we can tell you is that by leveraging this, it provides a more complete process for managing the entire ecosystem as well. And then, of course, you have a lot of different reports that you can generate out of these that you may need to have for management within your organization. You have exclusion and sanction status reports that allow you to run those. And more importantly, you even have the ability, all of our solutions allow you to schedule. So let's say you might want to have a report that goes out to certain individuals on a weekly or monthly basis that provides all that information on those that we have. What does my ecosystem look like? Where have we had issues? Where have we not had issues? So all, again, very automating a lot of this particular process. So that is the Integrity Shield, we call it SES, Sanctioned and Exclusion screening application. Really, our entities that are working with this really love this product because it takes a lot of the manual labor out of what they need to do, and it provides a much more complete risk reduction profile for them, because they know really on a daily basis, if anything happens, they're going to be notified and know directly where they need to focus their activities to manage that process. So some of the benefits, of course, it's quite simple. It's very what I would call user intuitive. It's got a simple user interface. It's as we said, a web-based managed by exception dashboard. So really, it's only going to call out to you things that you need to take activities on. Of course, it will always have all the auditing, the audit trails and reporting that you need to present should you have someone come to you and want to see how you are managing this process. You can distribute workflow, as I mentioned, and you have a complete ecosystem of coverage. And it allows you to manage all your exclusion, sanctions, and risk profiles in one centralized database. So we're going to go ahead and now launch into, first of all, any questions that you all may have. So please go to the Q&A portion of this as we summarize kind of these activities. And we're opening up to you for those of you who are participating. Should you be interested in trialing this out, we are more than happy to set you up. If you answer yes, we will go ahead and connect with you and actually send you or give you, just get you acclimated to how you go in and utilize the solution. But you can take this now, and I would encourage, if you are handling this process today, I would encourage any of you to please test it out, because you can come in if we set this up and allow you to just take a couple of those that you may have and enter them into the system and see how they compare to what you currently have. So you don't have to add all of your providers, all of your employees. You can just do a 1 or 2 check on those and have that available to you to compare to your current process. And again, what we typically find is once they see how simple and easily and cost effective this is, they're interested in using it for more than their own, just for those. So in summary, obviously the OCR and OIG is going to continue to enforce these requirements and seek payment if you have not, if you don't have good processes in place. Utilizing technology tools can help make your lives that much easier. I'm sure if many of you are compliance professionals, as you know, over the course of the last couple of years, your resources have been strapped as folks have had to deal and actually continue to deal with the issues with COVID and other types of new viruses that are being introduced into our environment. So having tools that can simplify that process and those processes for you and provide you the needed amount of protections, even that much better. So I'm going to go ahead and keep the poll open for a few more minutes for those of you who have not responded yet. It looks like about half of you have. And for those of you who have reached out and said yes, you'll be getting a follow-up email with an opportunity to go into a calendar and schedule a meeting to get that trial set up. It really will take not more than probably about 10 minutes to acclimate you and get you started. And then for those, again, who have indicated no or maybe later, just please note that we will be following up with you with a thank you for participating today and access to the content of this, as well as the webinar information or the audio of the webinar itself. So at this point, let's go ahead and open it up to any questions that folks may have. I see one. Chandi, can you maybe answer this? How are most of your folks going about providing the data that to check?
Yeah, so the thing is, if you have systems in place like your HR systems or vendor management systems, we can integrate with them to keep the data in sync. At the minimum, you could download from there and upload here as a bulk upload one time, and then keeping it updated every month as things change.
Great. And we're finding more interested in getting into those real-time sources because you get just that one more layer of additional protection. I have a question on costs. So we basically look at the volume, the number of individuals or entities that need to be checked within your ecosystem. And then we just have a monthly subscription price for leveraging that. So we would need to get some idea of what the size of the entities or the ecosystem that needs to be checked. And then we have a very nominal subscription fee for doing that. We do not base it upon the number of checks that are done. There are some third parties that will charge you each time you send them out a file to check on your behalf, and then they'll charge you for the number of checks that they did. In our case, we're going to check everything, and we're basically checking that nightly for you as well. And I actually have one more question that I see. What are your typical, I guess they're asking, is this only for hospitals? And the answer is no. I mean, we have customers that are provider management organizations. We have hospitals. We have critical access hospitals. We have home health agencies. And we also have, we actually have a group that's a surgical, outpatient surgical management company that is managing the outpatient surgeries on behalf of large health systems. And all of them have the requirements for making sure. And of course, anyone that's involved in the federally qualified health plans, because all of that money primarily is coming from the federal government, they have to be checking everybody within their systems. Well, good. I am, again, we'll leave it open where we're going to be able to give you back some time, obviously not needing to do this, use the full hour. I don't see any other questions coming up. And again, I will close the poll here in a minute. We'll give you one last chance for any of those that are still on that haven't answered to just indicate yes, no, or maybe later. And as I said, for those who have indicated yes, we'll get you set up very shortly. And for the rest, please know that we will continue to reach out to you and keep you updated on new things that are happening here with SureShield. And at any time, please feel free to reach out to us if there's anything we can do to help you all. So with that, we'll go ahead and conclude the session. If you want to learn more about the company, please, you can contact us at info@sure-shield.com or visit our website. We've actually just updated our website with a lot of new content and a lot of new reflection of the company. So please feel free to go to our website and learn more about a number of other things we do at SureShield as well. So again, thank you all for your participation. We look forward to the opportunity to perhaps working with you here in the near future. All the best, and thanks again.